Senator Hickenlooper.
Thank you, Mr. Chair. Thank all of you for being here and for your work on this very difficult issue. Let me start with Ms. Stevenson. In March 2025, the Department of Health and Human Services proposed modifications to the HIPAA security rule to enhance cybersecurity protections. Certainly the lack of standardized secure data sharing protocols in the healthcare industry increase our vulnerability to cyber. Obviously, encryption is currently not explicitly mandated under HIPAA. In Colorado, we have a national, what we call what was named the National Cybersecurity Center, which fills in a lot of these gaps at the state level and specifically provides training, both programs that impact assessments, other resources to rural hospitals throughout, not just Colorado, but in the region, because often that training has to happen in person to make a difference. How can we support the development of federal data sharing standards that build upon successful state-led efforts like what we have at the National Cybersecurity Center in Colorado Springs?
Thank you, Senator. I believe that what you're doing is good in terms of offering those local resources for training. The more educated everybody is, the better we can operate as a supply chain, a healthcare supply chain. It is a challenge, and the new HIPAA security rules that were proposed, while I do agree that standardization will be very helpful, encryption helpful, there were some things in there that were burdensome in terms of asset inventories and work that would be well beyond what we are able to do, especially in rural healthcare. So while I do agree we should go forward in that direction, I think that there's some modifications we could do.
Well, I agree with you there as well. I think certainly the cuts we're going to see to the rural healthcare system because of the cuts to Medicaid are going to be significant, and at a time when we should be providing more resources, less resources is going to be a problem. Mr. Quashie, wearable technology, and this is a little bit of an offline, but I think it's real. This wearable technology has become ubiquitous. People have smart watches that they wear, fitness trackers, collect all kinds of sensitive personal data, heart rate to blood oxygen, whether it's a ring or a wristwatch, whatever. But unless that data is being shared with a healthcare provider, the standard HIPAA security rule does not, what ordinarily would provide cybersecurity guidance for health records doesn't apply. It's true even for data collected, but that is very sensitive and very personal. Some states have enacted laws, such as the Colorado Privacy Act, that requires companies that collect such data to implement specific cybersecurity safeguards. Mr. Quashie, how can we address the cybersecurity gap that still exists for wearable devices not covered by the HIPAA security rule?
Thank you very much for the question, Senator. And I talked about this earlier in my opening statement. I think, and it's the position of my association, that we need a new comprehensive federal privacy law that covers, among others, those institutions and organizations that are not covered under HIPAA, right? And a couple of things to mention there is that for us, preempting existing state laws is going to be very key. So we have one standard that consumers and other stakeholders can adhere to. And number two, no private right of action. We believe that any new federal law should have strong enforcement teeth with a designated federal agency that will be the primary enforcer of the new law. Again, we can have state officers supplement and help enforce the federal law. And that, to us, will go a long way in solving some of this problem. But I think we need a new way to think about it. Unfortunately, given the digital economy we're in, state-centric solutions to this problem are going to be increasingly unfeasible. Data knows no borders. Data can travel across a border in a nanosecond. So I think we need to rethink how we approach some of these data-driven regulatory frameworks.
We agree with that. The states are the laboratories of democracy, but we need to be willing to go forward and take the lessons we're learning in the states and put them to a national level. Mr. Weissman, I'm going to try and look at my electronic watch, try and squeeze this in. And you talked a little bit about how we can help get resources for local hospitals to be better prepared and more resilient around cybersecurity attacks. How else can we support rural hospitals in this battle they're engaging? Because they are the undefended.
Well, when we broader institutionally, I think there are a lot of proposals that have been floated here that are important. At the end of the day, it's going to be money. It's going to be money and resources that is going to have to come from the federal government. The reconciliation bill goes in the opposite direction. In the area of cybersecurity, to some extent, it's the same thing, as we've heard compellingly. But I do think it also makes sense to think about the chains of responsibility. The problem with cybersecurity of rural hospitals is not just their own local thing. When Change Healthcare happened, that breach, that was a problem for every rural hospital. And what's the responsibility of United Health Group back to those rural hospitals? What should they have done in the first place to be more preventative? What should they have invested? They do have the resources, unlike the rural hospitals. And I think we need to be thinking much more about these top of the food chain players as well.
Thank you. I yield back to the chair.